Hello, everybody. Today we're going to be talking about compassion fatigue. My name is Danielle Hina, and I am a female crisis counselor. So compassion fatigue, also known as vicarious trauma or secondary traumatic stress. Compassion fatigue is a specific type of burnout. Vicarious trauma is the experience of trauma symptoms that can result from being repeatedly exposed to other people's trauma and or their stories of traumatic events. And this can really happen in situations of where you're working with other people. So anytime you're hearing, whether you're, for example, in mental health, you're hearing stories that people are telling you, and you're repeatedly being exposed to trauma, this vicarious trauma can happen. Secondary traumatic stress is the emotional pressure that results when an individual hears about the firsthand trauma experiences of another. So again, you're not experiencing the trauma yourself, it is being experienced through another person. Here are some definitions of compassion fatigue. It's characterized by physical and emotional exhaustion and the profound decrease in the ability to empathize. It is referred to as burnout, but they're not the same. Burnout is that stress on stress on stress feeling, and it's mental and physical exhaustion, typically felt by yourself because of what you're doing, as opposed to compassion fatigue, where it's being absorbed through another person. Here are a few symptoms: exhaustion, reduced ability to feel sympathy or empathy, anger, decreased use of alcohol, depersonalization, headaches, diminished sense of enjoyment, and absenteeism. So here are some tips: educating ourselves. So one, knowing what vicarious trauma is, secondary traumatic stress, what secondary traumatic stress is, what burnout is, and to be able to do that, cultivating a high level of self-awareness and understanding on when this type of fatigue setting in can help you to better protect yourself. Practice self-care, asking yourself what makes you happy. Cooking, cleaning, hydrating, those are all just a few. Setting emotional boundaries. So you can set those emotional boundaries with yourself and with your clients or patients or whoever you're working with. But you can also still remain compassionate, empathetic, and supportive of others without becoming overly involved and taking on another's pain. So maintaining that connection while reminding yourself and honoring that you are a separate person who has needs of your own as well. Engage in hobbies, asking yourself, what do you enjoy doing when you're not working? Is it fishing? Is it biking? Is it sewing? Having that work-life balance will really help lower stress and improve overall life satisfaction. Cultivating healthy friendships outside of work, keeping a journal, boosting your resiliency. So keep moving forward to your goals. Practice thought awareness. Practice cognitive reconstructing to change the way that you think about negative situations and bad events, and being proactive. Use positive coping strategies. And this can be, here I have on the side, emotion-focused coping strategies and problem-focused coping strategies. So asking yourself what you need to do or what works best for you to help cope. Use positive coping strategies for maybe some situations that you may be in. 9, identify workplace strategies. So support groups and open discussions about compassion fatigue, taking regular breaks, maybe taking a mental health day, maybe having an on-site counselor or a relaxation room where you can just go and decompress. And last but not least is seeking personal therapy, which can help process your feelings and help implement strategies that are personal to you. I also want to just add that personal therapy doesn't have to be talk therapy. There's art therapy, there's wilderness therapy, there's music therapy. So finding what works best for you can really help with have a better outcome for yourself. So I hope that you were able to learn more about vicarious trauma, secondary traumatic stress, compassion fatigue, and a little bit of burnout to help combat maybe some of those emotions, some of those feelings, some of that stress that you may be feeling because of the work that you do. Um, and I'll be the first to say thank you for the work that you do. Um, it's greatly appreciated, and keep on going, keep working towards your goals. Um, you are doing a great job. So thank you for the work that you do, and I hope you stay tuned in for our next video and have a good day.